Welcome to this episode of Retirement Crusaders. Let's take a look at the advantages of Medicare Advantage plans as compared to traditional Medicare. Now, I'm going to tell you right up front the punchline. I far prefer a Medicare Advantage plan, and I'll explain why. First, the basics. In traditional Medicare, you have complications, in my view. You have Part A, Part B, and Part D. Now, Part A covers your hospital care. And each time you go into the hospital, there's a $1,600 deductible that you pay, and then the rest of your hospital costs are taken care of. Now, the doctors that see you in the hospital would fall under Part B. So we'll get to that in a minute. So Part A, you pay the $1,600. Once you leave the hospital, if you're out of the hospital for 60 days and go back, you pay the $1,600 again. Now, Part A Medicare coverage is free for just about everybody. If you've worked for 40 quarters, a total of 10 years, in your lifetime before you reach 65, it's free. If you haven't, then you actually pay for Part A. It's $500 and something a month. But most people, it's free. So Part A is fairly simple. Now you have Part B. That covers outpatient, things that don't happen in a hospital. So obviously when you go to see a doctor, or you go for an x-ray, or you go to see a specialist, or any of those things that don't happen in a hospital, outpatient care would be Part B. Now the problem with Part B, there's a small deductible each year. I think it's $226 for 2023. So pretty small. But it has a large coinsurance amount. Coinsurance means for every dollar of expense, you pay 20%, Medicare pays 80%. So it's a cost sharing. Now that 20% could get really, really expensive if you have a lot of services you need, or you go to the doctor a lot, or you have a lot of high-priced specialists. Could be a lot of money. So if you have traditional Medicare with this Part A and B, you have to get a Medigap plan, a insurance policy from a private insurance company that will pay that 20% so you're not stuck with it. Okay? And then on top of this A and B, there's Part D. So Part D, you need to enroll with a private insurance company, and Part D covers your medicines. Now Part D, different companies have different arrangements. The biggest deductible for 2023 that's allowed by law is $505. Now once you pay that, the next $4,600 or so, you will pay maybe a small deductible or maybe a small coinsurance payment, not a lot. Once you and your plan have paid out $4,600 for medications for the year, then each dollar after that, you pay 25% of it. That can get pretty expensive. Once you get to $7,400 of out-of-pocket costs for the year, then you only pay 5% for any drugs above that. And next year, the 5% goes away. And even after that, the $7,400 out of pocket by law will drop to $2,000. So it gets better. If these types of retirement issues are useful to you, to have them discussed and to get this education, please below hit the subscribe button and the little bell icon, so each time we post on YouTube, you'll see a little notification to watch our next video, which is usually once a week. Also, in the description below, there's links to our free booklets on 10 different retirement topics. Take advantage of that. And last, there's a link below to join our Facebook group. So if you'd like to engage in discussions with other people in your stage of life, generally people over 55 or 60, and join in those conversations or just read what we're talking about, make sure you click the link to join the Facebook group, and I look forward to seeing you there. But who wants to know all those rules? I mean, who wants to sit there and say, oh, I thought I already satisfied my deductible. Let's see, I've already reached $4,600. No, I haven't. Don't they have to pay for this? Why should I have to pay 25%? So if you like having a desk full of papers with little bills, $26, $84, $112 for every doctor visit or medication you get, and you like this, like if you're bored in retirement and you like to have a messy desk full of papers to keep track of, then traditional Medicare is for you. I hate that stuff. That's why I'm in a Medicare Advantage plan. Now, a Medicare Advantage plan, when you do that, you trade in A, B, and D. You say to the government, keep your A, B, and D. And you choose a private insurer, a health maintenance organization, or a preferred provider organization, which would be a network that doctors belong to. You choose one of them to get your health care. And what happens is you trade your A, B, and D, you tell the government forget it, and the government will then pay a monthly amount to the HMO or the PPO to take care of you. So in my zip code, it's probably about $900 a month that the government, Medicare, is paying my HMO, my Medicare Advantage plan, $900 a month to take care of me. And so I pay $0 for that. No monthly premium to me. I don't have a Medigap policy. I don't have any of that stuff. I don't get any bills. I don't get all this nonsense. I think every time I order a drug, I do it online. I think it's $10 or something like that, but I don't get any bills. It's just a fixed amount. It's always the same. So I order my drugs online. They deliver them by mail. I don't have to go anywhere. I've never been to a Walgreens or a CVS to pick up my drugs. What nonsense. I get them right from the HMO. They send them to me. And when I go to the doctor, many HMOs are like this. Many Medicare Advantage plans are like this. They have these gigantic facilities. There's a hospital. There's all the regular doctors. There's the specialists. There's the x-ray machines. There's the MRI machines. Everything is in one location. I only need to know one address. That's all I need, because I go there and everything is in one place. Man, is that simple. The other thing that's really good is if I go to see one doctor and he pulls up my records, he sees everything from any other doctors I've visited. He can see all my medications. It's all in one computer system. Under traditional Medicare, you always got to be telling this doctor, oh yeah, but this doctor said this, and then this guy's telling you something else. Oh yeah, did I tell you I take this medication from this doctor? What a nightmare. What a mess. Who would do that kind of thing? Now, in defense of traditional Medicare, there are some advantages. What are they? If you travel a lot in the United States, traditional Medicare may be for you, because anywhere you go, you can find physicians that obviously will take Medicare and bill Medicare for their costs, and you'll be covered by your Medigap plan that covers the 20% of your Part B coverage that isn't covered by Medicare. So you can go anywhere and pick any doctor and you're good to go. The next thing is you can pick a specialist and go see a specialist without permission. Meaning, in traditional Medicare, you can go see any doctor that's happy to take payment from Medicare. You don't need to get permission from your doctor. So in my case, with the Medicare Advantage plan, one of the rules, they have rules. This is what people sometimes don't like. Now, I don't find the rules that hard to comply with. The rules in my Medicare Advantage plan is if I want to see a specialist, I need to get a referral from my regular doctor. Now, in my case, I pretty much just send him an email and say, hey, my knee is really bothering me. I really need to go see a knee specialist. And he'll send me an email back. He'll say, okay, you're all signed up. Go for the x-ray. And then the knee doctor will call you. Their office will call you for an appointment. So pretty much, I'm able to comply with this rule with just sending an email, and my regular doctor always just says, fine, I'll do whatever you need to do, and without having to wait or get permission or anything else. Now, one other advantage of traditional Medicare, Because with Part B, you really need to get this Medigap plan that covers the 20% that is not covered by Medicare. Many of those Medigap plans also cover your health care if you travel internationally. Now, there's a limit. Some have like a lifetime limit of $50,000 for medical care outside in the United States, but that may be helpful if you travel abroad frequently and maybe you stay for 2 weeks, 3 weeks, 4 weeks. Then traditional Medicare may be advantageous, because Medicare Advantage plans are usually regional, meaning you join them and they provide care in, say, the metropolitan area in which you live. You can't necessarily just go anywhere in the country and get care. Some of the plans do have a national footprint, but in many cases it's local. So that's a disadvantage of a Medicare Advantage plan if you find yourself traveling a lot. One of the other advantages that I like of my Medicare Advantage plan is a low out-of-pocket maximum. So here's what I mean. My Medicare Advantage plan, like many, they actually have two choices. I can pay $0 a month, and my out-of-pocket maximum in any 1 year is $6,000. It's the most I'll ever pay in a year, no matter how sick or hospital or anything. However, because I get these infusions through the year that it's a very expensive medication, I opted for their other plan. I pay $70 a month, but my out-of-pocket maximum for the year is $3,900. One of the big advantages of Medicare Advantage plans is most of them have a lower out-of-pocket maximum than you would have under traditional Medicare with your Part A, your Part B, and your Part D. One other advantage of the Medicare Advantage plans is they usually throw in some supplemental benefits. Like I get a little bit of dental coverage without paying for it. I think 2 teeth cleanings a year. I get $150 when I buy contact lenses. They pay the first $150. Oh, and then a free gym membership also at a local gym. Many Medicare Advantage plans throw in those benefits. So for all these reasons, simplicity, no little bills, no little things, no A, B, and D to keep track of. The little bonuses, the dental, the vision, and the gym membership. The lower out-of-pocket maximum per year. The fact that I can go to one facility and everything is there. And the fact that all the care is coordinated because all the doctors or specialists or whoever, it's all in one computer system from one provider. So there you have it. Your choice between Medicare Advantage and simplicity, which I value a lot, or traditional Medicare, which has these complicated pieces, but allows you flexibility to go to most any doctor, most anywhere. And if you have a favorite doctor that you've got to keep, Medicare, traditional Medicare will let you do that if you find that's really important to you. Thanks so much for watching. See you next time on Retirement Crusaders.